Well, I guess we'll just get started and we'll see if more people pop in. Thank you for joining us today for Needs Beyond Medicine's first cancer prevention and education webinar. My name is Liz Rollins and I am currently interning for Needs Beyond Medicine. Needs Beyond Medicine is a nonprofit organization that works to help cancer patients with some of their non-medical expenses and also does educational outreach on the signs and symptoms of cancer. Today, I'm excited to talk about cancer and then how to prevent it as well. If you have any questions, feel free to send them through the chat and I'll try to answer them periodically or at the end of the presentation. Okay, so just to get started, I just kind of wanted to give an overview about what cancer is and then also kind of what it would look like in the United States and then specifically in Utah. And then the majority of the presentation, we're going to be talking about the 3 most prevalent types of cancer in Utah, which are breast cancer, prostate cancer, and skin cancer. And then with that, we're going to kind of give an overview of what these cancers are, some of the risk factors, how you can prevent them, different treatment options, and the cost associated with them. Okay, so what is cancer? So cancer occurs when you have cells that are continually dividing and they could be spreading to surrounding areas. And then because of this, cancer cells aren't functioning the way they should, like a normal cell. So for example, they could be living longer than they should and just continuing to divide. And then not all cancers form tumors. So for example, like a blood cancer like lymphoma would not form a tumor. Okay, so when you have genetic changes that are occurring in DNA, cancer can occur. So why would these changes be a problem? So DNA is the genetic code for an organism. And so this would mean that the DNA is in charge of kind of telling how the organism, how they're supposed to function. And then when these changes are taking place in the DNA, oncogenes in cells can be misexpressed. And what's dangerous about this is that it can lead to uncontrolled cell growth because they can't be turned off. And so how does your body normally prevent tumors from growing? So in a normal cell, cancer is prevented through tumor suppressor genes. And it contains tumor suppressor genes, and they're responsible for correcting mistakes in the DNA, slowing cell division down, and then telling cells when they're supposed to die as well. And so if a cell has mutated to become a cancerous cell, the changes that have occurred in the DNA have inactivated the tumor suppressor genes, and so cell growth can no longer be controlled. And then when an individual is diagnosed with a type of cancer, their DNA might not have necessarily mutated the same as somebody else who has been diagnosed with that same type of cancer. And so this is one of the reasons why that maybe like one particular type of cancer treatment would be less or more effective for a person. There are other factors that go into that, and we'll kind of address some of those later. And so now I just kind of wanted to help you visualize what we've been talking about. So as you can see what a normal cell would look like, they divide very regularly, they're very organized, they're all the same shape, the nucleus is all the same, and then they don't cluster abnormally. On the other hand, like a cancerous cell, you have the cells that are dividing very rapidly, there's lots of variation in what they're looking like, the nucleus is also larger, and then they're clustering in ways that they shouldn't be. And so now I want to talk about 6 ways that genetic changes can occur in your DNA. And these are hereditary, UV radiation, chemicals, viruses, smoking, and cells dividing. So cancer can be caused by hereditary traits because a certain type of mutation could be more common in your family, and so that's passed down the generations. So for example, if your grandma and your mom both were diagnosed with the same type of cancer, you could be at a higher risk of developing that type of cancer as opposed to, like, let's say your friend that no one in their family had ever had that type of cancer before. The second is UV radiation, and this can lead to cancer because the UV rays will damage the DNA in your cells, it's specifically in your skin cells. And so, for example, if somebody is using tanning beds where they're spending lots of time outside without the proper protection, that would increase their risk of developing skin cancer. The next is exposure to chemicals. And so if you're exposed to certain kind of chemicals, such as like arsenic or benzene or beryllium for extended amounts of time, that will adversely affect your health as well. The fourth is viruses. And so how viruses work is when they enter a human cell is they kind of take the machinery of the cell and they use it to produce more viruses. And so they'll also sometimes insert their own DNA and RNA into the cell's DNA, and that would damage it. And so, for example, cervical cancer is commonly caused by some types of the human papillomavirus, or HPV. The fifth one is smoking. And so when an individual is smoking cigarettes, their immune system would be weakened and their DNA would be damaged from the different poisons that are in the cigarettes and also other contents like tar as well. And then according to the CDC, nearly 90% of all lung cancer cases are as a result of either the individual smoking or they've had extended exposure to secondhand smoke. And then the last is cell division. And we kind of talked a little bit about this earlier. So if you can recall, when cells are damaged, they can divide quickly and faster than they should. And so if they are dividing really fast, they can form like masses or tumors. Okay, so I think it's fair to say that everyone here has probably known somebody with cancer, whether it be a family member, a friend, or a neighbor. 38.4% of people will actually be diagnosed with some type of cancer in their life. And now let me kind of like make that statistic a little bit more real for you. So let's say you have 6 people in your immediate family. This would essentially mean that 2 of those people in your family would be diagnosed with some form of cancer in their lifetime. And then in 2020, it is estimated that more than 1.8 million people will be diagnosed with some type of cancer. Cancer is also the second leading cause of death in the United States after heart disease. So as you can see, cancer truly impacts the lives of millions of people in the United States every single year. Cancer is also very expensive. So in 2017, for example, there was $147.3 billion spent on cancer. And then to kind of help put that number into perspective for you, in 2017, the state of Utah's real GDP was $153.1 billion. So that means that 96% of Utah's GDP would cover that. So essentially all of Utah's cash flow in 2017 would have been needed to pay for cancer in the United States in 2017, which is crazy. So in 2020, in Utah, we are going to probably see around 11,900 people that will be diagnosed with some type of cancer. And then 18% of all deaths in Utah were also a result of cancer in 2015. And then the most common types of cancer in Utah are prostate, breast, and skin, kind of like I mentioned at the beginning. And if we were to kind of compare Utah to other states across the nation, we would see that we actually have the highest rate of melanoma, and I'll talk about that more later as well. And we also have pretty high rates of thyroid and prostate cancers as well. So now we're getting into breast cancer, and breast cancer is the most common form of cancer in Utah. It is estimated that in 2020, there will be 1,780 new cases. Among Utah women, it is the leading cause of death as well. And then as a cancer, breast cancer occurs when you have cells that are growing abnormally and they could form a mass in the breast. Typically, breast cancer starts in the milk-producing ducts, but it can also begin in the glandular tissue or other breast cells. The majority of people that are diagnosed with breast cancer are women, but men can still get it as well, and I'll address that a little bit more later as well. And then 5 to 10% of breast cancer results from gene mutations that could be passed along from family members. So now we're going to get into some of the risk factors associated with breast cancer. So like I said earlier, women make up the vast majority of breast cancer cases. In 2019, it is estimated that there were 270,000 new cases of breast cancer in the United States, and then there were only about 2,700 cases of men getting breast cancer. So as you can see, women are at a much higher risk for getting breast cancer. The next is increasing age. So the older you get, just the more time you have for your cells to mutate, so that could increase your risk of breast cancer as well. And then the next 3 kind of all go together. So having a history of breast conditions, having a history of breast cancer, or family history. So if you have a history of lobular carcinoma in situ, or LCIS, or atypical hyperplasia of the breast, that would put somebody at a higher risk of developing breast cancer. And so what LCIS is, it's when you have areas in the milk-producing glands that have abnormal cell growth. And then atypical hyperplasia is when you have abnormal cells that are beginning to accumulate in the breast, so they could start kind of forming a mass. And then additionally, if a person has had breast cancer in one of their breasts, they would be at a much higher risk of developing breast cancer in their other breast compared to somebody that's never had breast cancer before. And then with family history, and you'll see this like throughout the presentation, that if you have a family for history of something, you're just at a higher risk because you could have had that gene mutation passed along. And the next is obesity. And being obese would increase your risk of breast cancer. And then also kind of a little highlight, you'll kind of see that throughout like the presentation as well. Okay, the next couple all have to deal with hormones. So the next two kind of go along together really well. So if you start your period before you're 12 years old, and then you start menopause when you're older than 55, this would increase your risk because you have a longer lifetime exposure to the estrogen and progesterone hormones. And then there are some types of breast cancer that are very sensitive to these hormones, and so that's why that's a risk factor. And then something interesting as well that I had learned that I didn't know before is that before you give birth, your breast cells are actually considered immature. And what that means is that they are more sensitive to hormones, and they're also, they kind of grow a little bit quicker. And so after a woman's first full-term pregnancy, her breast cells will actually mature, and so they'll be less sensitive to hormones and they'll grow a lot more regularly. And then the next one is postmenopausal therapy. And so this could increase your risk of breast cancer, but if you were to stop using postmenopausal hormone therapy, that risk would go down, and I'll actually address this again on the next slide. And then the last risk factor is drinking alcohol. And drinking alcohol is actually a risk factor because that'll increase certain hormone, like the level of certain hormones in your body, and estrogen is actually one of them. And so alcohol consumption has been linked with hormone receptor positive breast cancer. So as you can see, hormones definitely play a role in breast cancer. So now we're getting into prevention. So cancer screenings like clinical breast exams and mammograms are a great way to kind of screen yourself and make sure if things are going okay. The American Cancer Society recommends that women that are between the age of 40 and 44 start getting annual mammograms. And then when they're 45 to 54, they should definitely be getting that annual mammogram just to make sure everything looks okay. And then when they're older than 55, depending upon their risk and what they kind of decide with their doctor, they should either still be getting their mammograms annually, or they should just be getting them every other year. But that would just be kind of a decision between you and your doctor. And then kind of also going along with that, a woman should regularly do a self-breast exam. And so she would want to just inspect her breast to see if there are any changes or lumps. And if there are, or if she has questions, she should go ahead and talk to her doctor. Exercise is another great way to prevent breast cancer. Ideally, you should be getting about 30 minutes, 5 to 6 days a week. That will help lower your risk. And then kind of going along with that, maintaining a healthy weight. And if you are exercising regularly, it'll be a lot easier for you to maintain that healthy weight. So those two go hand in hand. The next is eating a healthy diet. And so it's recommended that adults eat about 5 servings of fruits and vegetables a day, and you also wouldn't want to have a diet that's really high in refined sugar, or it's very high in fats or very high in calorie. And then kind of we're going to talk a little bit more about alcohol. And so it's recommended that if a woman chooses to drink alcohol, that she only drinks 1 drink a day, or she's just not drinking at all. And that'll kind of help lower the risk and keep the hormones level lower. And then we're going to talk a little bit more about the postmenopausal therapy. And so with this would really just be something that you'd want to talk to your doctor if that would be best for you, and kind of how high of a dose of the postmenopausal therapy you're using. In some cases, it's worth it for women to use this therapy because they could have very adverse side effects as they're going through menopause. And so increasing their risk of breast cancer would be better for them. And so that would just be a decision that you would want to make with your doctor. And so now we're going to get into the different treatment types of breast cancer. And so kind of depending upon the size and the stage of and the spread of the cancer, one method might be more or less effective for you. So the first method that could be used is surgery. And so there's different types of surgery. The first would be a lumpectomy. And this is when a doctor would remove the tumor from the breast, and they would also remove some of the surrounding tissue just to make sure that they get all of the cancer cells, because sometimes they'll shoot out of the tumor as they spread. And so you'd want to make sure that you get them all so your cancer doesn't reoccur. The next is a mastectomy, and this is when the whole breast tissue is removed. And then the next kind of surgery that you get is a sentinel node biopsy. And what this is they would take out some of the lymph nodes that are near the breast cancer, and they would examine them to see if there were any cancer cells in there. If there weren't, it would mean that it's very unlikely that you'd have cancer in the other lymph nodes. But if they do find some, they would go a little farther out and they would look at some of the other lymph nodes with an axillary lymph node dissection to see how the cancer had spread. Okay, the next is radiation therapy. And this works by killing cancer cells by either using high-powered energy beams, or you could be using little radioactive materials. And so if you're using the external beam radiation, kind of like the picture is showing, you would have a machine that would be shooting the high-powered X-ray beams through and to treat the affected area. And then if you were using the radioactive materials, just small amounts would be placed in the body to specifically kill the areas that have become cancerous in your body. The next is chemotherapy, and this kills cancer cells by targeting rapidly growing cells like cancer cells. And so this is typically used in breast cancer when it has spread to other areas of the body. It could also be used before surgery is done to kind of help shrink a tumor so it's easier to remove. The next is hormone therapy. And hormone therapy is used specifically in types of breast cancer that are very sensitive to hormones. And so this could be like estrogen receptor positive or progesterone receptor positive kinds of breast cancer. And there are 3 different types of hormone therapy as well. The first would use drugs that would inhibit the hormones from attaching to the cancer cells. The next would be after menopause had already occurred. And so they would want to make sure that estrogen wasn't being produced anymore, and they would just use a medication for that. And then the last way is that you would prevent hormones from being produced in the ovaries through either medication or surgery. The next way is target therapy drugs. And so they work by targeting cancer cells by targeting specifically different abnormalities that could be in the cell. So for example, some types of breast cancer need a protein called the human epidural growth factor 2 to survive. And so if you're taking a medication that specifically targets this protein, it would make it a lot more difficult for the cancer to grow. And then the last treatment type is immunotherapy. And this type of treatment would be used to kind of boost your immune system to kind of to better fight off the cancer cells, so they could take some of your immune system cells and they could kind of genetically engineer them to be more effective. And so you're going to see, as we're talking about breast cancer, skin cancer, and prostate cancer, that it really depends, the cost depends on the stage and the treatment, and also kind of the spread of the cancer. Out of the 3, breast cancer is the most expensive. And then as you can see, depending upon the stage of the cancer, the cost really varies. So if you have a very early stage compared to a very more advanced stage, the cost essentially doubles, but the average is about $85,000. So now we're going to get into prostate cancer. And so prostate cancer is the second most common type of cancer in Utah. It occurs in the male prostate gland, and it's when the cells have been growing and dividing more rapidly than they should. It isn't perfectly clear what causes prostate cancer, but we do know risk factors about how it could potentially develop, and we'll talk about those in the next slide. And then in 2020, it is estimated that there will be 1,380 new cases of prostate cancer in Utah. Something that's interesting is that early prostate cancer doesn't always show symptoms. However, you could use a prostate-specific antigen test or a digital rectal exam, which are 2 screening tools to kind of diagnose that, and we'll talk more about what those are in a minute. And then kind of like on the flip side, if a man has a more advanced stage prostate cancer, he could experience trouble urinating, he could have less force in his urine, he could have erectile dysfunction, pain in the pelvic area, or bone pain. Okay, and now we're going to get into risk factors. So men are actually more likely to be diagnosed with prostate cancer if they're at least 55 years old. It's not very common for a man to get prostate cancer if they're younger than 40. And then men who are African American are the highest risk group for being diagnosed with prostate cancer. Research hasn't clearly been able to say why that's the case, if it's a result of environment, diet, socioeconomic status, or a number of other factors. They're still trying to figure that out. And then additionally, men who are Asian or Hispanic have the lowest risk of developing prostate cancer. Next, if you have a family history of prostate cancer, you are 2 to 3 times more likely to be diagnosed with it as well. And then diets that don't contain adequate amounts of fruits and vegetables, they could be high in refined sugars, animal fats, and calories. That could lead to increasing your risk of prostate cancer as well. And then kind of like I mentioned with breast cancer, obesity would increase your risk of developing prostate cancer. And then something that's interesting though about this risk factor is that if a man is obese and they're diagnosed with prostate cancer, it's usually a more advanced stage. And then I think the smoking risk factor is probably the most interesting out of all of these. So what's interesting about this risk factor is if you are currently smoking, that would increase your risk of prostate cancer. However, let's say you have a man that smoked for X amount of years and then he quits. If you wait 10 years, you would look at him and then another man that was his same age that never smoked. They would essentially have the same risk now for developing prostate cancer, which is super interesting. So now we're going to get into prevention, and like any other type of cancer, there are some things that you can do to prevent it, but there are other things that you could just be naturally disposed to. But here are some things that you can do to prevent prostate cancer. So first is maintaining a healthy weight. Kind of like I mentioned earlier, if a man is overweight or obese, they could be diagnosed with a more aggressive or fatal form of cancer. So if this were to happen, their doctor would probably recommend that they're losing weight as they're getting treatment, kind of improve their health outcomes. The second is research has shown that physical activity can help lower your risk of prostate cancer. And then additionally, if you are engaging in vigorous physical activity, that would lower your risk of prostate cancer even more. And now you might be wondering, what would be considered vigorous physical activity? So I guess you could think about in a simple way that if you could carry on a very pleasant conversation with somebody while you're doing whatever you're doing, that probably isn't vigorous. But again, any form of exercise would be great, and that would help lower your risk of getting prostate cancer. The next is diet. And so that's a really great prevention tool. And so it's recommended to eat diets that are high in vegetables like broccoli, tomatoes, cabbage, cauliflower, soybeans, and other legumes. Eating fish could also be beneficial in lowering your risk as well. The next is just talking to your doctor about if a screening is right for you and kind of based on like how old you are, what your risk is. And then like I said earlier, 2 common types of screenings are a prostate-specific antigen test and a digital rectal exam. And a prostate-specific antigen test is when the health professional would withdraw some of the blood of the individual, and then they would look for a specific antigen that is only produced by the prostate. And so if they find that the blood levels are very high with a specific antigen, it could mean a number of things. It could first mean that the individual does have prostate cancer. It could also just mean that their prostate is enlarged, or they could have an infection, or their prostate could just be inflamed. So then they would want to do additional tests to kind of figure out what the problem was. Another test would be the digital rectal exam. And so this is when the doctor would place a lubricated gloved finger into the rectum to kind of see what the prostate kind of felt like and see if it was like enlarged or there were any tumors in there. And then something else that I just wanted to note is that there have been studies that have shown that taking certain vitamins like vitamin E, 5-alpha reductase inhibitors, or aspirin could reduce, have no effect, or maybe even increase your risk of prostate cancer in some groups. I would say with that, just if you've heard that before, just talk to your doctor to see what is best for you in your specific case. So now we get into treatment. Before we though talk about treatment, something else that I just wanted to note is that sometimes low risk prostate cancer won't immediately be treated, but rather it'll go under active surveillance. And so low risk prostate cancer could be that the cancer isn't growing very fast and it's not really spreading to other areas in the prostate. And then what active surveillance would look like is the man would regularly have their blood tested, and then they would have the digital rectal exam to make sure that things were still okay. However, delaying treatment isn't super common just because the health professional doesn't want your cancer to get worse. And so it just kind of depends. But now we will get into the different kinds of treatments. So the first one would be surgery. And so this would be when the health professional and the patient would kind of decide that the best option would be to actually remove the whole prostate. So yeah, the next is radiation therapy. So kind of if you recall from our discussion about breast cancer, this would be either the radiation would be coming through high-powered energy beams that are coming through a machine, or they could use small amounts of like the radioactive materials to specifically treat the cancer cells. The next is hormone therapy. And so this treatment in prostate cancer would specifically target testosterone. And so it would make it so the body wasn't producing testosterone anymore. And this would either cause the cancer cells to die, or they would grow slower just because they wouldn't have that testosterone that they needed anymore. The next is cryosurgery. And what this is, you're actually freezing the prostate tissue. And so this works by placing either like a small needle or a probe into the prostate, and then they'll put like an argon gas or like liquid nitrogen inside to freeze the prostate tissue and some of the surrounding tissue as well. And then they'll put a warm gas to kind of like thaw the prostate tissue and the cancer cells, and that will actually kill the cancer cells and some of the surrounding tissue. And this usually, though, in prostate cancer isn't the first method of treatment that they'll use, but it is used. And then the next method is chemotherapy. And then again, if you recall from what we talked about in breast cancer, chemotherapy specifically works by targeting cells that are rapidly growing. And the last possible treatment is immunotherapy. And how this would work, again, is that they would kind of genetically engineer your immune cells to kill cancer cells. In prostate cancer, I know, though, that this is a pretty expensive form of treatment, so it's usually used when the stage of the cancer is more advanced. And then with that, we're going to kind of get into cost. And so the costs, again, they vary greatly based on the stage of the treatment or the spread. The 5-year average for treating like a localized prostate cancer would range between $9,000 and $27,000. But again, it just kind of depends. Now we're going to get into skin cancer. And skin cancer is commonly caused by exposure to ultraviolet rays from the sun. And these rays will damage your DNA, and they could lead to abnormal cell growth. And then there are actually 3 different types of UV rays. There's UVA, UVB, and UVC. UVC rays, they actually can't penetrate the Earth's atmosphere, so we never see those here on Earth. UVA rays are actually the rays that specifically would increase your risk of melanoma, and they can also lead to skin aging. UVB rays are the rays that generally cause a sunburn, and they're the strongest in North America between 10 a.m. and 4 p.m. And Utah actually has the highest incident rate of cancer in the United States. And I'll get more into why that is the case when we talk about risk factors. And it is estimated that in 2020, there'll be 1,230 new cases of melanoma in Utah. And then there are 3 main types of skin cancer. There are other types, but we'll just highlight these 3. And so you have basal cell carcinoma, squamous cell carcinoma, and melanoma. And just to kind of help you visualize what those would look like, here are some examples. Obviously, they're not always going to look perfectly like this, but I just thought it would be helpful to kind of visually see what they look like. So basal cell carcinoma is the picture on the top left. And so it typically occurs on areas of the body that are exposed to sun, like your neck or your face. And it kind of looks like a waxy, flat, scar-like lesion. The picture on the bottom is of squamous cell carcinoma, and it generally also occurs in areas of the body that are typically exposed to the sun. So that could be like your face, your ears, your hands. And if an individual has a darker skin tone, they'll typically get this particular type of skin cancer in areas that don't get as much sun exposure. And it kind of looks like a firm, red, flat lesion, and it could kind of have a scaled or crusted surface as well. And basal cell carcinoma and squamous cell carcinoma, they're typically less likely to spread to other areas of the body. They'll just kind of stay localized into one area, but they can spread. It's just less common. And then the picture on the top left is of melanoma. And melanoma is the deadliest form of skin cancer. However, if you can catch it, though, in its early stages, it's extremely treatable. So I'll kind of go in a minute, like kind of how you can identify skin cancer. And then it can develop from an existing mole, or it can kind of just grow as melanoma somewhere on your body. In women, it's more common to occur on the lower legs. And then in men, it's more common to occur either on the trunk or the face. And it could appear like a kind of large brown colored or black kind of area. There will be variations in the color. You could also have red, pink, blue, white in there as well. It could also itch or burn or even bleed. And I know that was a lot of descriptions, but now we'll talk about kind of some ways that you can identify skin cancer. And then we had a question about sunscreen, and I will actually talk about sunscreen when we talk about prevention. So we'll get to that in a minute. Okay, so here's 5 ways that can kind of help you identify skin cancer. And you've probably heard this before, but I think it's a really great way to kind of help you identify if you have skin cancer or if you could be developing it. So first you'd want to kind of see if there was asymmetry in the mole. So if the 2 halves of the mole look different from each other, that could be a problem. Again, like with the border, if it looks kind of ragged or notched, that could be a problem as well. The color, kind of like I talked about with melanoma, you could have black, brown, pink, red, white, all throughout the mole. The diameter could be greater than 1/4 of an inch, and then just kind of like mentally help you decide what 1/4 of an inch is. That's about the size of like a pencil eraser. And then if the mole is evolving, so that could be changes in the color or the shape or the size, that could be a sign that you could be developing skin cancer. And then just the most important thing though, if you ever have questions about a mole or a spot on your skin, just go see your doctor and they can kind of help you figure out what's going on as well. So now we're going to get into risk factors. So the first risk factor is having a history of sunburns. And so when you get sunburned, your DNA is becoming damaged and some of your skin cells will actually die. And so this would be why that you peel when you get sunburned. It's because these dead skin cells are being shed. And so with each sunburn, that would increase your risk of skin cancer just because you're damaging your skin further. Another risk factor is having fair skin. And so those that have fair skin typically have less melanin, which is a pigment in your skin that is designed to kind of protect you from UV rays. However, do keep in mind though that anyone can develop skin cancer regardless of skin tone. And then the next 2 risk factors kind of go together. So that would be prolonged amounts of time in the sun and then using tanning beds. And when you're using, actually we'll talk about the exposure first. So when you have lots of time spent out in the sun and you're not using proper protection, that could increase your risk of being sunburned or tanned. And so now you might be wondering, why did I use risk and tan in the same sentence? So this is because being tan is actually your body's injury response to UV radiation, because it's trying to protect the body from future damage. However, with that, I wouldn't say it's a good idea to go say, oh, after the webinar, I'm going to go outside and I'm just going to get really tan to protect myself from the UV rays. You would do a whole lot better with sunscreen. So there you go. And then with tanning beds, there's actually no known safe amount of time spent in a tanning bed. So it's better just to not. And then the last, the next 2 kind of go together as well. So if you live at a high elevation or you're living in a sunny climate, that would increase your risk. And so this is, with the case of elevation, this is because you are experiencing greater amounts of UV radiation because there's less atmosphere between you and the ray. And so with Utah being on average at 6,100 feet in elevation, that would increase your risk a little bit. So as you can see, just with like the risk factors that we've talked about before, Utah has a lot of this. We have a population that is of European descent, a large population that's not genetically designed to live in a place like Utah. And so that would increase the risk of skin cancer. And then we also are at a pretty high elevation. And if you were to even look at like Summit County, I think they're at around 7,000 feet for their elevation. And so like if you're skiing in Park City, that would definitely increase your risk. But there's things that you can do to kind of prevent that, and we'll talk about that in a minute. The next risk factor is having many moles. And so most moles though are harmless, so I don't want you to go home and just freak out. But just that if you have more moles, you're at a higher risk. And then additionally, if you have what is called diplastic neving moles, that would increase your risk by another 10%. And this is an example of that. Diplastic neving moles kind of have that irregular shape and color, kind of similar to melanoma, but these moles aren't cancerous. Some of them might kind of look like a little bit like a fried egg. But yeah, so you just check your moles and you should be fine. And then the last risk factor is having a family history of skin cancer. And again, this is just because if you have genes for something, you could be at a higher risk for it. So now we're going to get into prevention of skin cancer. And so here are 5 things that you can do. So avoiding the sun between 10 a.m. and 4 p.m. And this is just because UV rays are the strongest at these times in North America. And this is even true when it's cloudy or winter. UV rays are strong enough to go through the clouds, and they can easily reflect off of surfaces like snow. The second way is to wear sunscreen that is at least SPF 30. And we had a question about SPF 30 versus SPF 50 versus SPF 100. I don't know a lot about how much, at what point that would be good. It's recommended to at least use SPF 30. I would say SPF 50 would for sure be better than SPF 30, just because with SPF 50, you'd be blocking a higher percentage of some of those UV rays. However, I don't know much about SPF 100 and how effective that is compared to the two. I can look that up though, and I can let you know though, Drew. And then with applying sunscreen, you would want to apply it about every 2 hours. However, if you are kind of swimming or you're really, really sweaty because it's super hot outside, you might want to be applying it a little bit more regularly than every 2 hours. And I know this seems so simple just to wear sunscreen, but it really can help block some of those UV rays. The next is wearing protective clothing. And so protective clothing could be something like a wide-brimmed hat, a baseball hat, sunglasses that block UVA and UVB rays, or clothing that's made from a kind of a tightly woven material to kind of keep that skin safe. And the next way is not to use tanning beds. And tanning beds are actually really dangerous. What's dangerous about them is that they specifically use UVA rays. And if you recall from our previous discussion, these rays are the ones that specifically cause melanoma. So if you are sitting in a tanning bed, you're essentially just increasing your risk of melanoma the whole time. So please don't use tanning beds. That's a great way to avoid skin cancer. And then the last way that you can prevent skin cancer is to regularly do kind of skin checks. And so you would just want to see if there are any changes in your existing mole, or if you have new moles that are growing very fast. And then going back to the sunscreen, my boss just actually messaged me and said there's only a 1% difference with the SPF degrees. With the SPF 30, it will help reflect 95% of the rays, and you want to make sure the expiration date is not past due, because it will lower the chemicals in sunscreen and make them less effective. And I would 100% agree with that, because I have used expired sunscreen before that I didn't know was expired, and I got sunburned. So there you go. So now we're going to get into the different treatment types of skin cancer. And so again, depending upon the type of skin cancer you have, or different how much it's spread, that would impact which treatment options you would do. I'm not going to specifically talk about what types of skin cancer would be used for each treatment option. I'll just kind of talk broadly about them. And so the first type of treatment is the cryosurgery, and we talked about this with prostate cancer. And so this is when you're actually freezing the cancer cells. And so this could also be used in skin cancer after they've kind of cut out some of that skin cancer, and then they'll kind of they'll freeze the outside of the incision to kind of make sure they get all the cancer cells again, so they don't recur. Another treatment method is excisional surgery. And so this is when the health professional would cut out they would cut out all the skin cancer that they can see, and then a small portion of the surrounding tissue, just again, help ensure that they get all of the cancer because they don't want it to come back. The next treatment method, Mohs surgery, is very similar to excisional surgery with one difference. So again, the health professional would cut out the visible skin cancer, and then they would also cut out a layer of healthy looking tissue. And then they would take this healthy layer of tissue, well, what they believe is healthy, and they would look at it to see if there are any cancer cells at all in this layer of skin. If there aren't, it means they got it all and you're probably fine in the future. But if they do see a couple cancer cells in there, they'll take another small layer and then they'll just repeat the process. And in skin cancer, this is typically used when you have a type of skin cancer that's harder to treat or it has reoccurred. And then with both breast and prostate cancer, we talked about radiation therapy, chemotherapy, and immunotherapy, and kind of how they work. The ideas are very similar with skin cancer, so we won't go into those again. But now we're going to go into photodynamic therapy, and I think this is really cool. So it's actually the picture of the right, and as you have noticed throughout the whole presentation, the pictures are kind of highlighting what we're talking about. But this looks really interesting, and because it is. And so how it works is that the individual would take a photosensitizer drug, and that is either placed on the affected area of the skin that they want to treat with like a cream or something, or they could also inject this drug into the bloodstream. And then they take a light that's a very specific wavelength, and they place it over the area. A special oxygen molecule then is formed, and it will kill the cancer cells when the drug is reacting with the light. And so I just think that's super cool that they figured out how to do that. And now we're going to kind of go into cost. And again, the cost of skin cancer will vary based on the treatment stage and type. The average kind of ranges between $1,700 and $56,000, depending upon kind of the stage you're at. However, though, it could be cheaper than $1,700. It just kind of depends. But there's kind of a idea for you. And so now we're just going to kind of recap a little bit. And so some of the key takeaways from the presentation that you can do to prevent your risk of cancer just in general is to exercise, maintain a healthy weight, eat a healthy diet, and wear sunscreen. And those things are super simple, but they really can help a lot. So I would encourage you to do all of those things. So now I'm just going to go back to Needs Beyond Medicine just a little bit. So again, our mission is to help cancer patients with non-medical expenses and then do educational outreach on the signs and symptoms of cancer. And so what would kind of be categorized as a non-medical expense could be something like helping pay for groceries, utilities, rent, or even transportation to and from medical facilities. In 2019, our relief program helped nearly 1,500 people, and then let me go back a little bit. In 2019, 56% of grant recipients were actually considered low income. And then throughout Needs Beyond Medicine's time kind of serving the community, we've helped more than 1,500 people that have been the recipients of our financial assistance grants. So now it would be great if you could help accomplish our mission. So with your help, we can continue to help cancer patients who are fighting for their lives. So for more information, please feel free to visit our website. You could also donate. There's the link, but you can find that on our website as well. And thank you so much for attending Needs Beyond Medicine's first Cancer Prevention and Education webinar. I really appreciate your attendance again. If there are any other questions that I can answer, please feel free to send them through the chat. Otherwise, I think we've covered everything. So thank you.